accelerate the research and understanding of that particular disease. And so those were the two models. And so we talked further and we came up with this idea of creating a think tank for late onset Tay-Sachs and Sandhoff diseases. And of course, to do this, we had to pull in the very best and brightest and involved researchers and clinicians. And many of them are on this, who are part of this think tank are actually on the call today. But the real driver in this, and she's in another session now, is really Cindy Tift, and many of you know her and the enormous role she's played at NIH in terms of advancing therapies for all forms of Tay-Sachs and Sandhoff disease, as well as GM1 gangliosidosis. So we held our first think tank meeting. We got together a group of about 15 or 20 investigators and clinicians in Hilton Head, hosted by the Burrick family, Alexis and Bill, and sponsored by the NTSAD through the help with funds that had been raised specifically for the LOTSS studies. And it was designed to be a one-day intense workshop, and which it was, and we covered topics similar to some you'll be hearing today on clinical issues, possible clinical trials. Then there were none going on, different models, cell models, animal models, therapy approaches. We ended up with action items to follow up on during the months ahead. We had a second think tank meeting a year later, also in Hilton Head, to continue to advance the same research and just collaborative involvement around this disease. That group grew to about 30. We got a bigger room in Hilton Head to host that. And we were going to do it again the next year, which would be 2020. Unfortunately, the pandemic got in the way of that. So instead, we had a 5-hour Zoom conference, again, expanding the group even further because the way Zoom would allow for that. And we had something like 40 participants there. And we're already now planning a meeting for this October. We're hoping it's going to be face-to-face, and it will be again in Hilton Head, and invitations are going out. So so that's the point of this, really, again, to accelerate research right now with the focus on individuals who are living with this condition. And I think what you'll see is in this special session on late onset Tay-Sachs and Sandhoff, even here as part of the family meeting, you'll see how these advances are really taking place. So let me stop there. I don't want to go over time. And Jerry, I'll turn it back to you. I'm happy, of course, to answer questions either now or later, if there are any.
Sure. I should have mentioned at the beginning of the session, if anyone does have questions, feel free to include them in the chat icon, and we'll get to them as we go through each speaker. And if there's time at the end, we can also field some additional questions. So maybe we do have a couple of minutes before our next speaker. Maybe I'll just tee one up for Steve. What would you say are some of the bigger advances or changes that you've seen over the last, let's say, 2 to 3 years with respect to late onset Tay-Sachs and how we think about the diseases and potential for treatment?
Well, I think the most exciting thing to me were certainly all the talks in this session today, but to get the updates from industry on the 2 clinical trials that we'll be hearing about. When we started this, there were no clinical trials underway, and it was a dream that we dreamed even in that first meeting. But it's taken some time. But there now are these 2 possible therapies that may be of real benefit, and And so I think that's really one of the most exciting parts. The other is just saying at these meetings, saying the way scientists and clinicians are willing to get together and talk, collaborate, really fully share all of their ideas, and coordinate the use of not only cell models, but also animal models. It's, again, it's really for a condition like this, conditions like this, it's just so important to get the best and the brightest putting their minds together to try to advance both understanding of the disease as well as therapy. And I think we'll hear this as we go through these talks ahead.
Great. Thanks so much, Steve.
Oh, happy to be with you.
All right, why don't we move on to our next speakers?